Tastilek, and I welcome you all. My name is Chudon, and I welcome you all on our second free virtual medical consultation camp organized by our NGO, Patient Care Trust. So first, let me brief about our 2-day schedule. On today's, we have like from 10 to 10:30, we'll be having a health talk by Dr. Nihar Ranjan Dash, and from 11 to 12, there will be individual medical consultation camp. And from 12 to 2, it's lunch break. Again, from 2, we'll be resuming the individual consultation. And on second day, that's tomorrow, that same thing, like from 10 to 10:30, they will be we'll be having this health talk by Dr. Lalit Kumar on cancer. And same thing, like from 11 to 12, there will be individual medical consultation. And from 12 to 2, there will be a lunch break. And from 2 to 4, same individual consultation. Now let me invite our NGO director, Mr. Sonam Wangela, to speak a few words. Sonam Wangela.
Dear respected doctors, a very good morning to all of you. Today I get this opportunity to thank all the doctors and as well as people who have made this camp possible. So let me give you a very brief introduction of our NGO. Our NGO name is Patient Care Trust and named and blessed by His Holiness the 14th Dalai Lama. We got it registered in 2014. The central office is located in Tibetan Colony, New Delhi. So my name is Sonam Wangela. I am the founding director of this NGO. Our leading advisor members of the NGO is His Eminence Professor Somdo Rinpoche, Lama Lobsang, and Kasurin Chenkandro Chogil, the sister-in-law of His Holiness the 14th Dalai Lama. His Eminence Professor Somdo Rinpoche is one of the most knowledgeable High Lamas of our time, was the former president of Central Tibetan Administration in exile. He was the advisor to the Global Education Association and was president of the Association of Indian University. Currently, he is the head of the Dalai Lama's office and the representative of His Holiness the Dalai Lama on many global issues. In regular activities, PCT receives the kind support of the honorable doctors from reputed government hospitals to provide pro bono medical case management service, alongside logistic and linguistic support such as reimbursement programs that cover the cost of treatment, travel, lodging, and food for patients undergoing treatment, organized PCT. We have been serving the vulnerable community in this capacity since 2012. PCT also conducts such as virtual and site-free medical camps in remote areas with the support of qualified specialists from high medical institutes. Following on from our first successful online virtual medical camp just last month, with the support of many honorable doctors from National Institute of Tuberculosis and Respiratory Disease, Delhi, Safdarjung Hospital, Delhi, PGI Chandigarh, Tanda Medical College, Himachal Pradesh. Once again, we have the honor and privilege, the support from 20 super medical specialists from 15 different departments of All India Institute of Medical Science, New Delhi. I experience my deepest gratitude to our honorable and long-term supported doctors for being a part of this virtual medical camp organized by Patient Care Trust on 10th and 11th February 2022. All these life-saving events would not have been possible without the kind support and commitment of these kind honorable doctors. Currently, the most vulnerable patients are the key beneficiaries of PCT activities. Otherwise, many of these patients have no means of attaining any medical treatment. As such, we considered high priority of these patients. The main obstacles faced by many vulnerable Tibetan patients, especially newcomers from Tibet, are language and financial barriers. In addition, they face difficulties navigating the Indian healthcare system and managing other linguistic issues such as transportation, accommodation, and etc. Whilst suffering emotional stress due to their illness. In times of medical crisis, it is next to impossible for such individuals and families to find the right treatment without our help in the community. The beneficiaries typically live in isolated settlements in India, have and will benefit from PCT plans. Dear respected doctors, 2021 was another challenging year all around and in particular with regards to access to medical care. Thanks to your kind continued commitment, we have been able to help numerous patients to receive quality health care through your kind support during this global pandemic crisis. The honorable doctors are essential in delivering medical expertise to the vulnerable community by way of PCT free medical camps. These have been a linchpin to provide medical facility to a large number of needy patients. And with your continued kind existence in it, we have been able to host our first and second ever online medical camps in 2022, and we are planning to continue this under your kind support in the future. Looking forward, we remain convinced that our cooperation is a key to securing proper health care in our community stuck with hardships. Once again, the PCT team is humbled and honored by your kind support. We would like to thank you all, especially honorable doctors, so much, as well as we wish all of you a most auspicious and bright new year ahead. Thank you so much for your kind support. Thank you, everyone. Thank you.
Thank you, Mr. Sanamongila. Now I would like to invite Dr. Nihar Ranjan Dash to speak about the gastrointestinal health awareness.
All, I am very thankful to Mr. Sonam, your NGO. You are doing a fantastic job for humanity, for the people. I can't say more than that. And I am really privileged. I feel very happy. It gives me immense pleasure to be associated with you and do some work for the people, though it is very, very minimal from my side. And please do keep up this good work. And I will, whenever I find time, and I would find time for you to work for you as much as possible. So I have been associated with some physical camps. This time we decided to do it online because of obvious reasons, mostly because of COVID. So let me address all of you regarding the COVID part. I'm sure you must be listening a lot of things from the media, the television, the radio about the COVID. My only submission is, do not get panicked or carried away. Only look at the government instructions from the TV, what the government is giving you. That is only the authentic thing, and you should follow it religiously. That is one. All of you, please get vaccinated as and when the government is saying. It is definitely working, and it is preventing the severity of the disease, and it might be preventing the occurrence of the disease itself, especially those who are vulnerable. Third thing, please don't get worried by the names Omicron, 19, like that. Another one is coming. Don't get worried. But take precautions as it is told to you. Maintain distance. Use mask. If you do not have surgical mask, use yourself 2 or 3 layered clothes. Maintain a distance, and there nothing will happen to you. If at all it will happen, it will just go away like any other common cold, like that. Even in common cold and viral diseases also, people do fall ill, they get admitted, and some of them may become serious. It is only those people who have other diseases like heart disease, lungs disease, like that, they only have risks. So similarly, I am a gastrointestinal tract surgeon. So during the COVID time, the gastrointestinal tract gets a beating. It is involved. All the systems was involved. This is also involved. It could be from a little bit mild problem to severe other problems. Now, just to summarize, during the COVID times, what you can have is, you can have loose motions, you can have loss of appetite. Earlier on, during COVID-19, you are having loss of taste. So this time when people are getting affected, some of them are getting little bit of nausea or to vomiting, and within a day or two, it's getting okay. There is something called long COVID, means long-term effect after the COVID has occurred. So the long-term effects of gastrointestinal tract are, the patient may have long-term diarrhea, loose motions, they can have nausea, they can have loss of weight, they can have little bit of liver problem, but not very difficult liver problems like jaundice, etc. And they are usually curable. They don't need any antibiotics, big medicines. Just maintain your water, your electrolytes like salts, and your hydration, and take care of your food. Take care of your food means your food should be hygienic. Hygienic means nothing more. Just wash the vegetable, wash your hand. These two things you have to take care. Before preparation, while eating, anything you are going to eat, even if it is a chocolate, the smallest of the thing, just clean your hand and take it. That's what, keep your utensils clean. It just takes a few minutes to wash it. That's what you have to do. So now the severity of the COVID is gradually going down, but please do not get relaxed and do not get panicked. Just maintain 1 or 2 things: mask, distance, vaccination. Just these 3 things. And coming to the gastrointestinal tract proper, gastrointestinal tract is a system of the body. There are many systems like nervous system, heart system which supplies blood, brain which gives you information and makes you awake, and we have lungs which gives us pure oxygen, and we have urinary system which excretes out the bad things from our body. We have musculoskeletal system which makes us walk, stand. Imagine we are standing on only 2 legs. So our body keeps balance to stand like that. So strength, muscles, bones. So, and to keep a coordination between all of them, we have a system of hormones. The hormones are secreted from near the brain in different areas of the body. They keep chemical coordination between different organs of the body. It's just like any electrical system we have. Our body functions like that. Like electricity comes from somewhere through the wires, comes to the computer, light, fan, etc. Similarly, the brain sends signals. We have nerves, we have chemicals which carry them to different parts of the body and keep a coordination among them. The gastrointestinal system is a system which provides you energy, because it's just like the petrol tank of a car and the pipes and supplying to the machines, the motors of the car. So our gastrointestinal system, gastro means stomach, intestine means after the stomach, the tube which takes the food down, and this gastrointestinal system takes the food and then takes purify. Imagine we cannot, suppose we are eating potato, the potato cannot go into our hand and stay here. It will block our blood vessels. The blood vessels block means no oxygen, the hands will die. So the food has to be broken down, and then the food has to be made so small that they can be absorbed and go into our blood circulation, because the food has to reach here also. Everywhere in the body it has to reach as a fuel. So gastrointestinal system, what it does mainly, it churns or it breaks down the food that we eat into very, very small pieces, and very, very small, so that they can go into the blood, and then that is called absorption, and then that goes to the different organs of the body, hand, legs, etc., and then there it is used and it produces fuel, that is produces energy, and many other things that occurs. So how our gastrointestinal system looks like? It starts from here. I think you can see my picture. So our digestion starts from our mouth itself. We have the teeth, we have the tongue, the teeth chews it, the tongue moves it towards the backside, and then here the saliva, the mouth secretion comes, mixes with the food. So this digestion itself starts from here. So what does that mean? It means that taking food, please chew it very well. Most of the times what happens, in especially in our cases, people who are always busy like Mr. Sonam, they have little time to chew their food, so they swallow and gulp the food. The food directly goes down like this, so it's not properly digested. So if you break it here well, it will get digested very well. So this is the mouth part. This part we call in medical science as pharynx, means Hindi as gala. The throat part, here in the throat part, you see the two things mix up, the food part and the air you are taking through your nose, and they mix up to form a single cavity. So when we eat, this part of the mouth that blocks the airway, so that food can go and food will not go into the airway. So this is the airway, this is the food pipe. So what does that mean? That means when you are eating, please do not talk. Please eat silently. If you talk during the while taking food, the air will also go in along with the food, and you will find gas bloating. Gas bloating is a very, very common problem in many people. So first and foremost thing when they come, we used to check their food habit. How are they chewing properly? Are they talking all the time? Are they eating while working, while standing, while moving? No. You sit down at a place and eat slowly, chew it very well. Chew a small amount. Most of the time you will find people filling up their mouth with big bolus of food, chewing and then gulping. No, whatever it is, it may be tasty, it may not be tasty. Take small frequent amount. So small amount, if you chew, two things will happen. One, you will manage with less amount of food. You will not take more of air. which is important, and your food will start getting digested in your mouth, especially rice type things. So when they come down, they come into the food pipe. The food pipe in English we call as esophagus. So in the esophagus, there is no digestion. Digestion, please remember, digestion means breaking down of the food and absorption. So this breaking down sometimes is done by the muscles. The muscles here, they contract to break them down. Muscles here also, and then there are some enzymes or chemicals which mix up with this food and breaks them down and make them very small particles, so that they can be absorbed from here into the body. So when this is in the food pipe, no digestion occurs. It only passes the food from here to our belly or the stomach. Stomach is the food reservoir. So what is the importance of this tube? Now, it's not a simple tube. What will happen? Suppose this tube, when you are taking food, the food is taken by contraction or constantly the muscle squeezes for let the food down. And suppose the food comes into this part of the food area, that the food reservoir, food pouch, which is called as stomach. The stomach secretes acid. Why there is acid in the stomach? The acid kills the bacteria of the food, and the acid helps in digestion. So once we start taking food, our brain says, "Oh, food has come. Please start producing acid." So the acid starts producing. Now, this food going into the stomach can only go in one direction, down. If the food will also go up at the same time, we won't be able to eat. Once we eat, they will come down, friend. Go up, come down, go up. No, that doesn't happen. So ideally, what should happen is the food should go down and join the stomach and enter into the stomach. If in some cases, what happens is, when you are especially nervous, we are very anxious, we are very tense, we are in a very hurry, we are hurrying taking food. Like I have office at 9, I am taking food at 9, so I have to reach office within 5 minutes. So those are the things which are very, very problematic. What happens in them? The food pipe gets confused. So what this guy is trying to do? So he is not obeying my rules. So the food will go, and the controlling mechanism here and here, this controlling mechanism, one is here, this allows food to go down and doesn't go up. This constriction mechanism, muscle, allows food to go down, doesn't allow to go up. If you are in a hurry all the time, your lifestyle doesn't change, these start functioning abnormally. So what will happen? The food tries to go up, back. So when this goes back, what will happen? The acid mix food will go into the food pipe. So acid, you know, is, if you pour acid into your hand, what will happen? It will burn. It will give a burning sensation. So you will have a burning pain when the acid goes up into the chest. So those of you who are having burning pain after food or in empty stomach, you understand that possibly the acid is refluxing into your tube. And this is a very, very common finding. What would you do in those cases? First of all, you change your lifestyle. That sit down, take your time, eat small amounts, chew well, take your time. And then if this thing happens, immediately take water. Do not delay. The water will dilute the acid and relieve your burning pain. So if that is not working, suppose it is a chronic condition, the doctors give antacids, that we call as antacids. The antacids, what happens? They neutralize the acid and gives you relief. So this is a very common problem of the food pipe that we people face. What will happen if you do not treat this and you allow this to happen? The irritation in the food pipe will lead to ulcer formation, ulcer formation, and then the ulcer will go on to become cancer formation. And this is we are seeing many cases of cancer formation, especially from northeast area and everywhere in the country we are finding. So this cancer formation, once this happens, it will block the lumen, block the opening or the food pipe. The patient will start experiencing difficulty in swallowing the food. He will say, "Doctor, I am unable to swallow the food. What is happening?" Or they will say, "The food is getting stuck. It is not coming down. I have to take water to pass it down." So you understand, especially, all these cancer things, they are very, very long standing. They occur, they take 10 years, 15 years to come out to show their symptoms. So it's not that yesterday cancer occurred and today I will get a symptom. No, all the gastrointestinal cancers, for many cancers, they are slow growing thing. So once you have cancer of the esophagus or other causes of blockade of the esophagus, you will experience difficulty in swallowing. There are also other causes, but if an elderly person above 50 years is complaining of, "I'm having stickiness," or "I'm unable to swallow," or "I'm experiencing pain in swallowing," please refer to a doctor. Do not treat yourself. These things are treatable, curable cases. The doctor can treat it, though they require higher centers to treat, but they can be treated. As I said, food reversal is one of the cause of cancer of esophagus. There are other causes which are very, very important. Two of them are, one is smoking and another is alcohol. So please do not avoid smoking. The smoking is not helping our body in any way. Smoking can cause cancer of the food pipe, smoking can cause cancer of the mouth, lungs, and so many things. It can cause heart attack. So I do not smoke. I have never smoked. I have never taken alcohol. So I can say, please do not do smoking. So smoking can cause a person who has long-standing smoking causing difficulty in eating. I am sure that this person is having possibly cancer of the esophagus. So there could be some non-cancer things also causing difficulty in swallowing. So don't get panicked. If you have this problem, please show it to a doctor. These are certain signs of the body which you should not ignore. Like, for example, simple indigestion, gas formation, simple loose motion. You can ignore, wait for 3 days, 7 days, manage on your own. But if these things are happening, please consult a doctor. Now, the food, I was speaking about alcohol. I will tell you more about alcohol when I reach further down into the liver. So coming down to the stomach, when the food reaches here, the stomach, the work of the stomach is the work. 1 minute, sorry. So the work of the stomach is that it churns the food, it mixes the food, breaks it. It is a very powerful organ, and then it sends through this into the intestine. The intestine starts from here, and you can see in the intestine there is a yellow color gland, there is a green color structure. The yellow color is the pancreas, we call it as pancreas. The green color is bile. The bile comes from the liver. So this is the food pipe, then this is the stomach and food reservoir, and the food is pushed into this small intestine. The yellow thing is their pancreas, the green thing. Now, what is this yellow and green? The pancreas and this bile, they secrete chemicals, enzymes for digestion of the food. So what do you mean by digestion of the food, and what does it occur? The food we eat are rice, dal, chapati, vegetables, eggs, etc. Those are the food. But those food cannot go into our blood. What can go into our blood is the minute components, small molecule components in the food. So they are mostly of 4 or 5 types. One is called a carbohydrate, like you see the starch, the rice, the sweets. Carbohydrates, they give us energy. The proteins, they help us building our body, building of the muscles, bones, everything, whatever building structure. Protein is the building structure of the body, and it also acts in many aspects. It gives us protection also, protection against outside infection, etc. The fat, third thing is the fat. What does the fat do? The fat gives us protection. Because of the fat, we look beautiful. What the fat gives us a figure. It gives us a shock absorber, and it also does some other metabolic functions in the body. So these are the 3 main nutrients, and then we have some vitamins like A, D, E, K, vitamin B, C. You have had vitamin D. So these vitamins helps us utilizing this main carbohydrate, protein and fat, and do different functions of the body. And then we have some trace elements in the food like iron, calcium, magnesium, etc. They are also used for different body functions. Now all these are there in the food what you are taking, in small amount or big amount. Some food contains some of them, some food doesn't contain. A simple example is milk. The milk contains calcium, the milk contains protein, the milk contains carbohydrate, the milk contains all the vitamins except vitamin C. The vitamin C helps in many ways in our body, gives us protection, helps maintaining our the barriers in the body. So vitamin C is not there in the milk. Where is vitamin C? The vitamin C is mostly in the lettuce type vitamin C rich foods like lemon, oranges, etc. etc. So the vitamin C, that means a person who is only having milk is likely to develop vitamin C deficiency. So he has to be very careful. One of the most important cause of vitamin C deficiency is bleeding from the mouth. So if you find any child who is on milk and has bleeding from the mouth, his gum, the mouth cavity is looking swollen, so think that possibility is because of vitamin C deficiencies. So we must take vitamin rich food like lemon, oranges as much as possible. So these vitamins are not only rich here, they are present in many places also. So why we are mixing our rice, dal, chapati, vegetable, not only for our taste, so that we can get the entire thing in our food. So you must take care that you are taking all things. You are taking rice, or you are taking wheat, you are taking dal, which provides the protein. All these things are present in all these foods, but something is more in. For example, if you take egg, you have lots of protein in that and less of carbohydrate. If you take rice or wheat, that is half carbohydrate, half protein is there. And vitamins mostly are there in the vegetables. Green leafy vegetables contains lots of vitamin B, Vitamin B helps us in many ways. Now, these green leafy vegetables we are taking, a lot of people ask whether we take them raw or we cook them. Some of the vegetable green leafy things you can take them raw, but nowadays what is happening is lots of foods are grown up in chemicals. Careful. So when you are having green leafy vegetables, for cooking, soak them in water for some time and then boil it or cook it and take it. So now two things I must say here, that if you take these green leafy vegetables, or means it is like threads of the cloth, threads of the dresses. The threads of the body, and the fibers make your enough fibers. These fibers comes from the green leafy vegetables, from the fruits, like that. You should here. You must have seen that when the person falls ill, what we do, we say, oh, take fruit, you'll be all right. You must understand that fruit has a very there are only few vitamins like any other thing. So in other words, please do not run after fruit, that if I take fruit, then I'll become Now, what is there in fruit? There are certain fruits like apple, which contains lot sugar, fructose, the sweetening things, and some. It's because, you see, when a person he has fever or something, his taste changes. So you give fruit for a change of taste, and they also feel good, but they have to be fresh. The frozen fruits, the fruits will come from the cold storages. Run after the fruits. You have everything, whatever you are eating. You may eat chicken. The red meat is not good. Scientifically, the red meat, the meat which looks red, things which are bad for our body. We have two types of fat. One is a good in our body. They can cause blockage of the arteries and heart attacks. So you must be very careful what you are taking. How do you know which is a bad fat, which is a good fat? The basic ideas is normally what we are taking, you, me, all of us are taking, are usually good fat, except the which should be taken in minimal quantity. If you are taking 4 eggs a day, the eggs, please do not have any yellow. The yellow is good for our body, but not so much. Limit the intake. That brings us to 70% of our body weight is water. 2/3. And where is that water in our body? We don't find any water in our body. But if you see, they are everywhere in the body. Everything in our body is wet. Like we have blood, which is liquid. Chemicals which are coming into our abdomen are watery. So the fat which is there, if you burn them, they become oils and they exude water. So it's everywhere in our body, water is there. So a normal person needs about 4 liters of water every day, depending upon if it is very hot or very cold. So at least 3 to 4 liters of water. That means that water includes all your liquid things. Suppose you are drinking milk, you are drinking a liter of fruit juice. So I guess I am saying that rather than taking rather than taking apple juice, you take apples. It will have fibers. There is a method to take the water. When you are taking water, please sit down, calm, and take water. You take water. While you get up in the morning, take a glass of water. Then before going to bathroom, take a glass of water. You keep water in bottles on your table and see that everybody important system of our body. Do not take water immediately after taking food. Suppose I have taken now a meal, rice, dal, chapati, etc. Please do not take 1 glass of water on top of that. What will happen? The stomach will get very, very distended. So give a gap. You may take small amount of water to clear the food, and then after 1 hour, take water. So understand, I think these things have helped, must have helped you. Now, after this, the things get digested here. So the intestine contains the digested. The long loop is because the food passes through this, takes time to get adjusted. One is a small intestine. You can see they're narrow and absorption of all the protein, carbohydrate, fats, is also partly absorbed from here. Then the rest of the thing. This whitish thing, this is called large intestine. What happens in large intestine? In large intestine, what happens is liquid, like water, watery, and we pass. When it goes here, the water is completely absorbed or mostly absorbed into our blood. The blood, so that the blood remains liquid. So what remains is something semi-solid or solid. So when this goes and passes through this to outside, then we pass solid stool. So if you do not take enough water, your stool will be constipated. It will be suppose there is some infection or something here, what will happen? The water will that we call as loose motions. The loose motions can contracting fast, the patient will pass liquid and frequent stool. Suppose a person is not passing stool for 2 days, don't get worried. Situations. Do not get worried by how many times you are passing. Know that you are having problem. If you are having motions you are not passing in India, or because our food is containing lots of fibers, as I said, the threads, the fibers. The fibers just pass like this. The fibers are very important for our body. Fiber, because the fibers form the stool. They form the proper stool which we are passing. Second, the fibers can absorb the toxins, because with the food we take lots of toxic things, lot of bad things, and they will try to throw them away. So fiber intake is very important. If you do not take lot of, they take very purified things. They do not take lots of fibers. So their motion habit is even one upon your habit. So suppose you are not passing stool for 2 days. Sir, what is there? So we may give some medicines to pass the stool. So these things get irritated. There is a lot of fluid secreted into it, and the stool becomes watery. Suppose you have taken some food outside and you get infection or something. No need to rush to the doctor, or you may go to the doctor, but nothing will happen if you delay a little bit. So what you have to do is you just cut down with a small pinch of salt and little bit ORS powder, oral rehydration therapy solution powder. So in 1 glass of water, you add half a teaspoonful of this ORS. Loose motion, they stop eating, they stop drinking completely. This will take away water salts from our body, which will be very bad for us. So we have to supplement. So when you are having loose motions, stop the solid foods for 6 hours or so, and then start this ORS powder, or thing. Take it frequently, small amount, and then it will automatically stop within a day or two when those bad things. 2 days or 3 days maximum, and this is going on increasing, and you find that the person is not looking well to you. Not looking well means When water goes out from our body, you try to pinch his skin up. This skin, normally if you pinch the skin up, the skin goes to normal. But if there is loss of water, if you pinch the skin up and leave it, it will not go down. So though, and his eyes will appear a little bit confused. He is sleeping all the time, not talking, not cheerful. Take him to the doctor, even if it is one day. A person has got 60, 70 times a day looking bad, so talk to the doctor. But 5, 6 times a day, loose motions, you can give him water or solution, what I said. Don't get worried. So this will get corrected. Along with that, if there is infection, the patient may have vomiting. Now, this is another issue. A vomiting in a small child is completely different into your hand. Do not manage yourself. Please try to, don't get worried, but at least if there is a doctor nearby who knows, at least tell them that my child is having this. But if an adult person vomiting occurs, the same thing what you have to do, just wait and watch. He might have taken something which has irritated his stomach, upset his stomach, so he is having vomiting. The vomiting will automatically stop. But during the vomiting, don't give him anything. When in between, just give him a teaspoonful of ORS powder. A pinch of ORS solution, just give him to keep him in his mouth and slowly take. And as time goes on, slowly increasing. Vomiting doesn't mean that you will stop him completely giving any liquids or something. And along with that, the patient may have pain. Pain is a very, very common symptom or sign of gastrointestinal involvement. How do you know which part is causing pain to me? If the pain is because of the small intestine, you will find pain around the mid-abdomen, around your umbilicus. If the pain is because of this large bowel, then you will have pain below the umbilicus. So these are basic causes of pain. The pain could be a burning type, burning pain, jalan. So burning pain occurs when there is some problem with the stomach, there is acid going up. So if there is some ulcer, colicky type of pain means pain is coming, going, coming, going. So some problem here, the pain comes, becomes more and slowly goes away. This can cause because of infection. Once the infection is controlled, the pain also subsides. But if the pain remains, causes the patient to roll around here and there, so you must consult a doctor. So usually it is not only pain, the pain can be thing can occur. Now these are some acute things that can occur. You can manage yourself. Basically, you just have to control your diet and dietary habit and water and ORS. You can manage a lot of the things. Another thing occurs with us is, all of us, if we do not maintain hygiene, we may get the worms. Like suppose we got some food from the market which is not properly cooked, or it is not washed. Foods, and mostly this comes through the animals. The animal take food from here and there. There is worms. There are worms' eggs mixed with them, with the soil. The animal takes, and the animals' poops or feces, they get contaminated with the vegetables which grow on the field, and then we eat them without washing. the mutton we will get the infection of the worms. So what are the symptoms of worm infestation? You can see the worms coming out through the motions. You can see something cutting or itching around your anal area. Some of the worms, like hookworm, they suck out blood out of you. The patient will become pale slowly and steadily. He will lose weight. You are in an area where people are having worms, or you know it, the best thing is very well, or wash your hand with soap before taking anything. And there is the last thing I need to discuss about this thing is is this organ, this gray color organ is our liver. This digestion, the liver is the storehouse of energy. All these foods, the defense system, the liver maintains our blood fluid. So liver does many things. So please if you do not do harm to the liver, liver will remain always liver by taking drinks, alcohol. I'm not saying, as I said in the beginning, regarding alcohol. The alcohol can also be protected to us, but it has to be in good form, good brand, and good nature. There are many types of alcohol which are extremely bad. So that also causes damage. You have had hepatitis A, B, C viruses. These viruses come through the food, and also some of them A comes from the food, E comes from the food, B and C they comes through the blood from the injections. So be very careful. Swelling of the liver, lack of function of the liver, then the liver causes have jaundice. His eyes look. So any person whose eyes are yellow, please show the doctor. Do not manage yourself. So this yellowness could be because of the liver, could be because of many other things. You should be very careful. So the liver sometimes after getting regularly infected, regularly bitten up, stops functioning. And then we call cirrhosis of the liver. The liver. And lastly, you must understand how to suspect a cancer of the intestinal tract. The cancer of the intestinal tract, they only become symptomatic when they are very long. So the bad signs of cancer of the intestinal tract are loss of appetite, food is not getting absorbed. Then bleeding per rectum through the anus, or bleeding pale for a long time, especially in elderly people above age of 50. If these things are occurring, pain not subsiding, continuously occurring, weakness, lethargy, not tolerating food, vomiting, those are the things which you should be, these are bad signs of cancer. But not necessarily if these things are occurring means the patient is having cancer. This can occur because of many other things. But if you get doctor's help, so take care of your gut. Gut means your intestine. Morning, do gargling. If you do regular gargling, your throat will be clean, your virus diseases will be less. So those are the hygienic things you should. And I hope you have got some messages. So that they can also take care of themselves. Thank you, Sonam. Thank you, all of you.